Type 2 diabetes diagnosis tests and treatments. Your doctor can test your blood for signs of type 2 diabetes. Usually, they will test you in 2 days to confirm the diagnosis. But if your blood glucose is very high or you have many symptoms, one test may be all you need. A1C, it's like an average of your blood glucose over the past 2 or 3 months. Fasting plasma glucose. This is also known as a fasting blood sugar test. It measures your blood sugar on an empty stomach. You want to be able to eat or drink anything except water for 8 hours before the test. Oral glucose tolerance test. This checks your blood glucose before and 2 hours after you drink something sweet to see how your body handles the sugar. Type 2 diabetes treatment. Managing type 2 diabetes includes a mix of lifestyle changes and medication. Lifestyle changes. You may be able to reach your target blood sugar levels with diet and exercise alone. Like weight loss, dropping extra pounds can help. While losing 5% of your body weight is good, losing at least 7% and keeping it off seems to be ideal. That means someone who weighs 180 pounds can change their blood sugar level by losing around 13 pounds. Weight loss can seem overwhelming, but portion control and eating healthy foods are a good place to start. Healthy eating. There is no specific diet for type 2 diabetes. A registered dietitian can teach you about carbs and help you make a meal plan you can stick with. Focus on eating fewer calories, cutting back on refined carbs, especially sweets, adding vegetables and fruit to your diet, getting more fiber. Exercise. Try to get 30 to 60 minutes of physical activity every day. You can walk, bike, swim, or do anything else that gets your heart rate up. Pair that with strength training, like yoga or weightlifting. If you take a medication that lowers your blood sugar, you might need a snack before a workout. Watch your blood sugar levels. Depending on your treatment, especially if you are on insulin, your doctor will tell you if you need to test your blood sugar levels and how often to do it. Medication. If lifestyle changes don't get you to your target blood sugar levels, you may need medication. Some of the most common for type 2 diabetes include metformin. This is usually the first medication used to treat type 2 diabetes. It lowers the amount of glucose your liver makes and helps your body to respond better to insulin it does make. Sulfonylureas. This group of drugs helps your body make more insulin. Meglitinides. They help your body make more insulin, and they work faster than sulfonylureas. Glitazones. Like metformin, they make you more sensitive to insulin. Dipeptidyl peptidase 4 inhibitors. These medications help you lower your blood sugar levels, but they can also cause joint pain and can inflame your pancreas. Glucagon-like peptide 1 receptor agonists. You take these medications with a needle to slow digestion and lower blood sugar levels. Sodium glucose transport protein 2 inhibitors. These help your kidneys filter out more glucose. Insulin. You might take long-lasting shots at night. Even if you change your lifestyle and take your medicine as directed, your blood sugar may still get worse over time. That doesn't mean you have done something wrong. Diabetes is progressive, and many people eventually need more than one drug. When you take more than one drug to control type 2 diabetes, that's called combination therapy. You and your doctor should work together to find the best mix for you. Usually, you will keep taking metformin and add something else. What that may depend on your situation. Some drugs control blood sugar spikes. Your doctor may call this hyperglycemia that come right after meals, for instance. Others are more effective at stopping drops in blood sugar, hypoglycemia between meals. Some may help with weight loss or cholesterol, as well as your diabetes. You and your doctor should talk about any possible side effects. Cost may be an issue as well. If you take a medicine or medication for something else, that will need to be factored into any decision. You will need to see your doctor more often when you start taking a new combination of drugs. You might find that adding a second drug doesn't bring your blood sugar under control, or the combination of 2 drugs might work only for a short time. If that happens, your doctor might consider a third non-insulin drug. You may start insulin therapy.